Hello, everyone, and welcome to this event. It's actually the first event in person after such a long time, and it's absolutely great to see you all here. We have Ian Hamilton. He joined us in 2009 as a research assistant, and he progressed in his career, and he was promoted as professor last year. And congratulations, Ian. It's the first time. Actually, we have so many people here to say congratulations. I will say a couple of things about Ian research. So Ian research is in the built environment. He is evaluating climate mitigation actions and energy efficiency in the built environment, their impact on energy efficiency and demand and buildings. Is looking at energy performance along indoor and associated health and well-being conditions and environmental conditions. He also led a successful international interdisciplinary research program on the transition to a sustainably energy efficient, resilient, healthy, and equitable built environment with funding from a number of sources: UK Research Councils, Wellcome Trust, British Council, UK government, Mexican government, and also funding from Horizon Europe type of funding. So we have Ian here. Congratulations, Ian, again, and this is your time.
Okay, well, thank you very much, Catalina, and thank you all for coming out this evening. And it's a real pleasure to be able to be here and speak, yes, in person, live, not two-dimensional. But also to say, for those who are joining live and two-dimensional afterwards, watching this, to say thank you for those who couldn't be here. There are several who have messaged and said, good luck. So I appreciate that. I kind of looked around to see if there was a standard template of how to do this a little bit. There's some things. Basically, it's an opportunity for me to tell you about the work that I've been doing over the last number of years, and a little bit at the end about kind of where I think I'll be going next in terms of the research that I conducted, and also an opportunity to highlight all the many people who I've worked with over these past almost 14 years at UCL. So it's been great. So I've got some slides. I'm going to go through some of them quickly, others not so quickly. And if I can get this to work forward somehow, just this, or just neither. There we go. The first IT disaster.
Is that the only one?
Well, I mean, I've been practicing. There we go. Okay, so that's the thing that Catalina effectively read. But I thought I would actually start with this image. And the reason why this image is important is because it's the home I grew up in a very small town in northwestern Ontario. This is an R2000 house. The R2000 home standard, which was developed by the NRCan for 1982, was the very first time it was certified. And this home was effectively a advanced, not quite passive design, but certainly one which was focused on efficiency, on being able to, be as low carbon as possible. At the time, that wasn't a concern, but effectively a high energy performance. You can see that the windows have been replaced. They were originally wood framed, argon filled, low E, as I say, built in 1982 by my father. And that really set the scene and the interest because, as you can tell, it's a cold part of the world and there's a lot of snow. In fact, this was taken this year where there had been a record amount of snow, and I actually had helped clear the roof off because we were worried about collapse. But the importance of energy goes beyond, the importance to me of energy performance of building goes beyond, saving energy. It's really about what this entails, which was, growing up in a home that was warm, it was comfortable. We would walk around in our t-shirts. Why? Because in the middle of winter, it just was so efficiently designed. And so that really set forward. And I remember many years of poring over architectural design books and looking at the engineered drawings and thinking, how do we build more of these things? Because I didn't really understand at the time that this was a unique building construction approach at the time. It's now effectively the building standard in Canada as of today. A few years ago, it was kind of superseded, but this was, built a long while ago. And for anybody who is curious where 40 degrees meet with Celsius and Fahrenheit, that's a picture of at that time. So it gets a bit chilly. There are people I would absolutely like to thank. And, first really several who are in the crowd today. So my PhD supervisory team, Taj Ruskin, Phil Stedman, Alex Summerfield, who really couldn't have been better at guiding me through the research that I conducted, each had great sets of skills to be able to bring and help me through this. The other thing being Harry Bruns, whom a colleague of ours who passed away some time ago, but whom the Harry's Cafe was named after, really instrumental in bringing together this idea of let's take big data sets that exist within this country and see what we can find out about in terms of energy performance and looking at them. And it was that which I spent the better part of 10 years working on, the data sets that he helped curate and pull together. I'd also like to thank Mike Davies, who really brought me into UCL and offered me that initial research assistant position. What I didn't tell Catalina was it was only for about 6 months at the time, and then we carried on into other things. But he invited me to take part in the Lucid Heat Island project, and he gave me a challenge which really inspired me, which was, can you cycle around London and collect loggers off of lampposts, and how quickly can you do that? So that worked out, but I was very grateful for his support in the first paper that I ended up publishing, which I have to admit has been cited over 130 times, it seems to me, which is still a surprise. But effectively, it asked a simple question: how much heat do buildings release into the urban environment? And so we used, some approaches to come up with what we think was a number for that. And that really kind of set me into this idea of, well, this is what a researcher does. I mean, we cycle around, we grab things out of the environment we're in, we write them all down, and voila, present. Didn't realize it was kind of probably beginner's luck getting it through that way. But I'd also like to thank Paul Wilkinson, again, a colleague of ours who very sadly recently passed away. And just, what an influence, very special man who really inspired me on the health dimensions of this. So although he can't be here today, he's in the work that I'm presenting. And what is that work? It's this intersection, this nexus activity. And what does that really mean? It kind of means I couldn't make up my mind between a variety of things. So, as I said before, I love buildings, particularly housing, energy performance, but it brings so many other things. It brings comfort, it brings space and well-being. And those translate into an important factor, which is how buildings really modify and protect us or not, how they can be a risk to us, they can present harms. But then even, beyond that is this challenge of the existential and real crisis of climate change, what our world is facing today and what it means as it responds to health and what it means as we build our built environment and manage that. And most challenging is the fact that energy plays such an important contribution to climate change that we have to address and completely reformulate how it is that we are using energy in our buildings. So I thought I would just start by doing a bit of scene setting, and this reflects the work that I've been doing along with the UN Environment Program and the International Energy Agency for a few years, where we kind of set the scene. We want to say, what is the sector looking like and where is it going? So this is some numbers that I'm very grateful Harry Kennard, who's here, has helped pull together. And we say, so what's been happening since the Paris Agreement with the building sector? Well, frankly, things have gone up, things have gone down. Our emissions intensity have reduced, but overall emissions continue to grow. We're building more buildings. We are continuing to see policies that relate to building performance and efficiency being instrumented through things like the nationally determined contributions, the number of countries with building energy codes, and looking at how we're investing. And these are important indicators of, the interest in ensuring that buildings are being built to the future to a better standard, but it's nowhere near enough. I mean, the reason why buildings are so important is because they comprise probably around 36 or more % of the energy use in the world, and around 37% of the emissions. And that's a substantial amount that needs to be addressed, both directly through, the energy being used in the boiler downstairs and the gas emitted, but also in the electricity sector that we have. And this is all across the world. That's a major, major challenge. So one of the ways in which we might do that is by looking at how a set of things interact to create an indicator of change. And this is something that I've helped with the BPIE looking at that index for decarbonization. And basically, when we think about where we need to go, and this is really informing the actions that we have to be taking around, are we investing enough? Are emissions dropping enough or not at all? Are we building the right type of buildings going forward? And this gives an illustration for the last couple of years how things have been going. So if we're over the line, we're doing on track. If we're below the line, we're not doing so well. And basically, we've not been doing so well. COVID last year, or in terms of the indicator, it was an anomaly. We probably accelerated emissions more quickly than we ever have. And it seems unknown at this point whether that curve will be bent down over time. And that's where policy and investments will come in. So when we look at things like building energy codes across the world, which are really critical, because I go back to that R2000 home, it's taken the better part of 40 years for that to become the standard code for buildings in Canada. We need to be able to move far more quickly than that. And when you look at how many countries across the world might have a mandatory code versus a voluntary code. So basically saying the policies that regulate how we construct, what we construct, need to more quickly. None of them are zero energy quite yet. They're headed that way for some few number of countries, but for the most part, we're well off track. And if you look forward into this estimates where the world is going to be growing in population terms, the reality is that much of that will take place in countries that have no energy performance code, meaning that buildings and their emissions and demands for energy will continue to grow more over time. And this is an incredibly challenging issue because in order to build buildings that are meeting zero carbon, we're going to be doing so in countries that at the moment have real resource and economic concerns as well as social ones that maybe don't make this a priority. So we have this to contend with. And I just add this as it's a slide from the IEA, but basically it says, right, so if we're going to meet net zero, what is it doing? So we didn't produce this data, but it illustrates the challenge when you look at where these expected emission reductions are supposed to be coming from. So behavior and avoided demand, right? Small amount there. Let's be more efficient. What does that mean? Efficiency itself, about how we build the buildings, the fabric, the systems we have there, and kind of continued electrification, basically zero carbon electricity. Great, that's critically important. But it's this bit on the efficiency and behavior, which I think is really challenging for us because it's highly uncertain how we're going to get there. And lastly, just to kind of finish off on this, which highlights policies that countries are putting together in their nationally determined contributions, cite buildings as one of the most frequent things that they will be addressing. Efficiency of buildings to be adapted to climate change in the future, but effectively there's a recognition that it's got to be the sector that brings forward a lot of the sort of emission reduction that we need to see. So it's a problem that obviously has a high level of concern, but the problem is how are we going to do that? So a lot of the work that I focused on very early on, as I mentioned, those large databases, were trying to build some way of being able to look across that landscape and be able to look towards how you understand buildings in real use. And know that as a stock, know that as a population of buildings, because they're diverse. You can see that in this image. So one of the reasons why we want to change this current approach is because we have committed to significantly reducing energy use and emissions. That needs to improve the intensity. Much of this is coming from the fact that buildings are such a substantial amount of our emissions. And the fact is it's going to be investment of trillions of dollars, and therefore we need to do so with care. We at times of both economic crisis and energy crisis, we need to be careful with the way we spend money, and we need to target it effectively. So our history of this is that we're very good at studying the single building. We can monitor it, we can measure it, we can go through it in great detail. The problem that we've tended to do is that as a group of buildings, we tend to say, okay, well, they're probably similar enough. We know not all buildings are yellow, some of them are blue. The problem becomes one of when you have a population of buildings, which, as you can see in this photo, that diversity of the same building archetype suddenly changes and morphs. And not only are they different colors, they've been added onto, they're different shapes, they're being used for all sorts of different purposes. So to be able to study the building sector not as an average or as a single typology, but rather to recognize the diversity of the stock. And so we want to be able to treat the building as a stock as a population. And so we give an example of this in the health world, and hence why the relationship of working with Paul Wilkinson and other colleagues at London School of Hygiene really brings this forward, was to be able to think about the way that the building stock may be considered as a population in the way that epidemiology considers people and that population around health outcomes. So in epidemiology, there's socio-behavioral, psychological component, basically think of it as the behaviors. We have the biomedical and physiological component, which is really the system, the physiology of the individual. And then we have the environments and the exposures that those individuals are in. And epidemiology as a method looks across all of those together. So it's data-driven, which is incredibly important. We need to make sure that we're measuring and really understanding the things that are changing. It looks at how spread and severity, experiencing that the last number of years, we know more about epidemiology as a general public than we ever thought we would, probably ever wanted to. And we can look at the spread and severity of a condition, whether that's ill health or in the case of energy use among buildings. And really it's about evaluating what's the current issue that we have, how do we treat that issue, how do we move from this state to another state? And in the case of the built environment, from the current energy intensive state and high emissions to one which is low. I've added this in, it's a little slide that Alex Summerfield always liked to use, but basically this is a figure of London. This is, not so far away from UCL, and this is John Snow's map. And the reason why I quite like this map is because it does a few things. One is each black dot or bar is a death attributed to cholera. And there was this spread of disease at the time where it was unknown what was the cause, what was the source of cholera that related to this wave of deaths. So what he did was he plotted these about this map, and each one it kind of begins to center around this issue where there's a water pump nearby, and he feels that it proposes that this is the source of the potential for infection of disease. What was great though about this in particular, not only his insight, was the method he used about tracking this also accommodated for the fact that there was an outlier in the data, not shown in this figure, of a woman in Hampstead who died. Unknown how that happened with cholera, is the only individual death, and it was because one of her house servants was sent down to get water from this particular well that she liked so much the flavor of. Little did she know. But the point is that it's about investigating phenomena on the ground. It's about tracking these changes over time and trying to come up with proposals around understanding them. So energy epidemiology, which is an area I've worked with colleagues to develop, was basically the study of what is upon the people, but in this case, the building stock. And it's about the systematic study of distributions, of patterns of energy use, and looking at their causes and, influences, not influences, in the population. So we can think of it the same way. We have people and behavior, we have buildings and technologies, we have environments and societies, and together we can look at that in a lens of energy epidemiology. So, one of the things we think of in doing so and using this approach, we can have a more interdisciplinary research method, which is incredibly important for bringing in insights. We can look at these large scale studies and begin to look at the factors that are affecting the prevalence. In other words, how frequent is something and how common does it change? And we can look at this using empirically measured data. There's things like data protocols. So being able to standardize how we do this, report it, is really important for building an evidence base. And getting feedback. Because one thing that we know is we can certainly invest lots of money, we can certainly make changes and things, but do we know if they work? Does that inform the policy around how it is that we need to further adapt our built environment? And ultimately, this needs to be communicated with researchers across a variety and policymakers. So I'm not going to dwell too much on this, but the idea being that it brings together a concept of population-based methods to look at how we can shift towards a low-carbon society, built environment. And I've got an example of this, which was in using the data, and I should also give a mention to Simon Elam, who also was quite instrumental in helping Harry and colleagues pull all this together as a data source. through what was known as the Home Energy Efficiency Database. And the opportunity that we took in working with the UK government was, let's take all these data points around houses, their energy performance, the features of retrofits that have been a part of a government program scheme, all the gas and electricity meter data that all of these homes have, and pull them together into a giant database. And then what do we do with that? And that's why the epidemiological approach was quite helpful as to how to use a population. So rather than study the whole thing and try and do some analysis on 23 million properties, instead we would take a sampled approach. So we would construct, using this example here, a representative set of houses in England, and over 100,000 in terms of their size, their shape, their location, their energy use, the retrofit status, et cetera, and to start looking at some questions that we could ask of them. And so the idea of being able to look at, well, how quickly does energy demand change over time? When you look at this figure, it's a distribution of energy demand. So basically, this is under the curve is 100%, all the houses. And there's lots who use quite a lot of gas and electricity. And then there's many who use probably not enough. But it's that middle group that we need to be able to shift. We need to shift the high tails, but as a proportion, they're not so much. The other question we can ask about this sort of data was, well, how impactful were all these measures that we've been investing in? And what impact did they have on energy demand? And so using this method, we're able to say, look, we can take hundreds of thousands of homes and we can know that not all home is going to be the same in terms of how people use them, but on average, how much, or not on average, across this distribution, how much energy is being saved. And so the red line is this, okay, everybody in 2005, we knew they hadn't yet had anything done. So we specifically sampled that group, no retrofits, and then we looked at those who did and those who didn't have a retrofit. I mean, it sounds like a simple idea, it is, but basically it helps to determine how much energy saving might we have expected and really measured. And the other thing that we can do is we can say, well, what happens if you add things in? Because we need to do packages of retrofits, not just one-offs. Do we save more energy as we go? And the answer is, well, yes, but it does seem that there's going to be, on one hand, a limit, but also, there are those who are saving a lot on one end of the distribution, those who are saving not so much. And it's about being able to understand, yes, these things combine, but they don't combine in quite the same way our models would have suggested. We know that there's going to be differences among those who are occupying the home, whether they are, say, private renters, owner-occupiers, social renters. There's going to be differences in the needs that they have for energy in their home. And that's going to be reflected in the savings that they might experience. We also know that as a result of kind of the socioeconomic backgrounds, is that that's going to also affect how much energy savings, say, might happen. And so again, when we look at income levels, the homes in middle and higher income save more energy than those in lower income neighborhoods. The reason for that is because unmet needs for lower income means that they can now, in a more efficient home, be warmer, use the boiler more, etc. And those who are happy to pay, but are paying for the energy use, can save. They met their needs, it's no problem. So a lot of the, again, I just put these up, but basically using these types of methods, we're able to pick through the data, we'll be able to look at all these examples and samples and understand that there is diversity within the population of energy savers, and to be able to then develop policies that are more attuned to them. So the one on the figure on the left, or the little box plot thing, basically says, if you get a bunch of packages together, a bunch of retrofit, you're more likely to save more energy. That's basically what that figure says. You're more likely to save quite a lot of energy if you have all of them together. And it's important for us to know that those are the things that give us an evidence base to say these are having a real effect, but they are a diverse effect, and we need to do that. It's all right. You've made it here. So what do we need to do in order to, reach these, say, goals of 2030 or 2050? And it's really about this middle group. We need to squeeze that middle group. And so again, the sorts of efforts that we need to make, potential energy savings, what types of boilers, what type of heating and insulation needs to be attuned to that. And the reality is, it's this middle group who are least directed in terms of policy, right? Because the implication is, of course, they should be able to pay their own investment in efficiencies, but there's not necessarily inducements for that to happen at the moment. Whereas what we see on the left-hand side is that we don't necessarily want people to use less energy than they should in order to meet their needs. So the policies right now, through a lot of the government programs, are certainly directed towards, rightly, those who need assistance. But there's not a lot of policy directed at the bulk of energy users within the building stock in the UK. And this was basically just a point of saying, you know, if we took the findings from that other study that I showed, and we applied them to all the homes that were eligible to have these in the UK, we would save about 10% of the annual energy demand. So it's not a lot. We need to get better at how we're delivering that treatment. Because one of the things that health analysis offers is we can think about an intervention in two ways. The intervention, the boiler, the loft insulation, whatever it might be, can be intervened, and it can be not very well done. Or in the way in which it's delivered, you know, is it hitting the right target group? Is it being taken up by the right, you know, households that need it? You know, so it's really about the delivery and the mechanism of delivery. Both need to work. So, like I mentioned before, that energy savings is great, but really who cares? Because that doesn't actually solve anything that people are wanting. Just the fact that you use less gas is actually going to be not about the gas, it's about going to be saving energy. It's going to be saving money, pardon me. It's going to be, can my home be warmer? And, you know, is it more valuable? So these are the questions when we look at creating a more efficient building stock. It's really about sustainability then and health and many other things. But this is the nexus idea that we want to be able to say, let's decarbonize the building sector, but for a lot of other reasons, not just emissions. This is something which very early on in one of the second projects I think I came in to work on, actually might have been the first with Mike and Paul Wilkinson, was looking at the relationship between these mitigation actions in buildings and health. So we might improve a building's heat loss, you know, less heat loss. We might reduce how much air leakage it has. And so then what? Well, by the end of the hour long of me talking, there's going to be more CO2 in this room. You can get a little bit sleepier unless it's well ventilated. That might happen. It's okay. I've lectured for a long time now. People fall asleep in classes. But it'll be related to ventilation and the quality of that building and all the different things that we do in buildings that can create indoor air pollution. And so here we're looking at things like, okay, we have indoor sources, you know, particulates that come from cooking or volatile organic compounds from furnitures, smoking indoors, etc., or natural gases like radon coming up through the ground into homes. And if you seal that up and you make it more airtight, warmer, great, but also without ventilation, you're going to increase the amount of exposure you have to all these pollutants. So we need to do these measures that I was talking about before carefully. We have to understand what the implications will be for health. So the fact is that we do spend the majority of our time indoors. And as a result of that, building can have an substantial influence on our health and well-being. We know that will come through a variety of means, such as the thermal environment. What's the temperature indoors? What's the amount of air pollution I get exposed to? And so when we look at, for example, this is a study that we did on radon exposure in houses across the UK as a modeling activity. Say, all right, so radon, which is the second leading cause of lung cancer in the UK. I mean, off by a long way from smoking, but it is an important determination of lung cancer, and it's not something that you want to expose yourself to. Where does it come from? It comes up naturally from the ground and is present in certain parts of the country more than others. But it's not the high concentration areas who know and are targeted with government actions. It's actually all these other areas that really are kind of, well, it's low doses, but they accumulate over a long period of time. And when we retrofit a home, what's the implication going to be? Well, we did do this study, and we were able to work with colleagues at Public Health England to bring together a database of, about 500,000 radon measurements. And we connected that into this database that we had helped to construct, home energy efficiency. And we looked at all the radon measurements, then the energy performance, and asked a question, which is, what's the relationship between energy performance, i.e. a more well-insulated and more airtight home, and this naturally occurring gas, which can cause lung cancer, and you don't really want to have it around in your home. And so basically, at the moment, it appears that more insulated houses, more efficient houses, will have a higher radon level indoors. And the reasoning for that is because most of them are not in a high radon action area. So in other words, there's not a mitigation effort to go and remove those radon emissions. And when we look at, again, the idea of all these things built together, the concern is that, well, we continue to increase the radon concentrations. So this affects our health. This is something that we need to do for energy purposes, but we need to do carefully. Part of the problem here is that we don't have a lot of good guidance. How is it that installers can go through and improve that building without causing harm? So if you're a part of a government scheme, there is a documentation that needs to be used. But actually, for the most part, most work is going to be done by builders whom may not be required to follow those, and they're going to use their own judgment. And that's important to understand how that process works. But we also need to ensure that they're aware of these risks. The other issue that we might look at is, say, temperature in homes. So this is an important issue because, well, the coming cost of energy and yes, the recent changes mean that it's going to be maybe a little bit less impactful than it was previously. But to protect ourselves from winter is to have, yes, a warm home. What this slide is basically showing them is that top dark blue line is an EPC home with a rating of C. C is considered to be, okay in the middle. It's not anywhere where we need to get to, but it's sufficient as being a warm enough home. The issue is when we look at the temperature difference between those who are in C and above and those who are in the rest of the stock. So 50% of houses in the UK are in D and below. So in other words, the majority of homes in the country, and they're going to be colder. And so one of the mechanisms to protect health and of course reduce emissions is to improve their performance, as I mentioned carefully with ventilation, but we do see a relationship between that and warmer homes. We also find that in terms of when it's cold outdoors, these homes are performing much better in terms of keeping a warmer indoor environment. So a lot of this work comes from these large data sets. But there's some peculiarities, which are, this is some work that we did with the Health Survey for England. And basically, it was looking at the association between indoor temperature and health, self-reported health. Surely warmer homes are healthier homes. Well, in this study, what we found was actually warmer homes associated more with people who have more ill health. And we questioned, well, why might that be the case? And so this is where, again, digging into what might be happening is, well, is it that people who are living with disability and illness are advised to keep a warmer home? We do know that for a number of diseases that do relate to self-reported ill health, you're going to be given guidance from the NHS. Or is it the type of home you live in? Are certain older people who are living in certain types of homes who are more prone to these diseases, being impacted in different ways? And so the concern really is to make sure that we understand what's creating that determination. Is it the built environment? Is it personal behavior and choices? What's causing or potentially leading towards risk of ill health? So we need to be able to dig into and understand what the mechanisms are. So we might do this through complicated models. I'm not going to dwell on this, but basically we can do these types of studies. These types of studies have lots of data behind them in terms of relationship that exists between performance and temperature, like I was showing before. And we build all these things together, which, with colleagues across several institutes here and LSHTM, IEDE, spent a lot of time looking at the evidence to try and pull together an understanding of what impact, if you were to improve buildings, could have on different diseases, whether that was cardiovascular mortality, stroke, lung cancer, etc. If we do all these things, can we show how impactful this will be on health? And the type of research that we were doing with this is saying, look, let's take all the buildings in the UK and do what I said, which is to make them more efficient. What might that mean in terms of health? And if we don't pay attention to ventilation, the risks are that we can we can create health harms. We want to avoid that. So we need to make sure that when we do the retrofits that we're talking about, that we pay attention to ventilation in particular, but also ensure that the installers understand these risks as well as homeowners. So we're working now with some big data sets, again, looking now much more into the health angle. So we want to understand more about what the relationships are between a lot of these measures and interventions and specific health outcomes. So we're working with colleagues in UCL epidemiology, where we're going to be pulling together these large data sets, a survey of aging, a survey of health, the home energy efficiency and national energy efficiency databases, bring them all together to ask these types of questions, which are, do interventions offer an opportunity to protect health? And which ones do or don't? And we can better evaluate the impact of those programs. One thing I'm going to very briefly touch on is because it's taken up a lot of my life as well in different forms is the Lancet Countdown on Health and Climate Change. And this is something where when looking across the variety of interactions that I've been involved in, this is again another area which intersects between health and climate change and the built environment, in particular my interests, but really the importance of our work, the importance of the work that I'm conducting with my colleagues, that we have a finite amount of time to address a big challenge. And this transformation that we need to take place is happening today. And these are just the main messages from that Lancet Countdown report from last year, which was basically, we're not doing what we need to be doing as quickly as we can. The implications this is going to have on our health are happening now. And ultimately, if we roll out the same way in which we've addressed things like COVID with great inequities, we're not going to be supporting a healthier outcome. So I'm not going to dwell on these because I want to leave some time for some questions and thoughts, etc. But basically, we need to see this red line and all those lines tilt down as quickly as we can. And I think Harry calculated that it would take about 150 years to achieve the emissions of net zero on our current rate. We clearly don't have that long. We also know that there's going to be a relationship between fuel uses and health that I mentioned before, particulates, the performance of building, how much fuel we use. A lot of this across the world is going to be from sources that are not gas and electricity, and they have a higher risk of concentrations of particulates and mortality related to that. And we see that here, which is basically the energy sector working with colleagues in Austria to map out and show the implications of the energy sector on air pollution. And a lot of this is coming from power, homes, transport, etc. So seeing these shift as quickly as possible. And then again, when we look at other sources of emissions that impact on our health, things like diet, this isn't an area that I work in, but it's an important one that we need to consider. And also looking at healthcare sector emissions and being able to say, look, across the sectors, the built environments, etc., being able to deliver health services in a low carbon fashion is critical. How is it that we're going to achieve things like SDG 7, which is health for all, in a way that's very carbon intense? We can't do that in the same way. We have to reformulate how the NHS, for example, is delivering in a zero carbon form. So we did some work, and this is again something that says, well, what happens if the world decides to meet its Paris agreements through its nationally determined contributions? What happens if we were to start putting not only policies that were good for emission reduction, but also good for health? And so we can look at that in terms of air pollution, diet, and active travel. And basically to say, okay, we can reduce emissions, that's great, but the implications are we can really have some real benefit to our health by cycling more, having infrastructure that supports walking and cycling in cities, by reducing the amount of air pollution coming from a variety of fuels, electrification, etc., and by having healthier diets. These things all make a big impact on emissions, but they also will make a big impact on our health. So in these 9 countries that we looked at, we could be saving 1.6 million lives per year by 2040. 6 related to air pollution, 6.4 related to diet, and another 2 related to active travel. I'm going to skip over that for a second because I just want to get a little bit further along, but basically saying, by using an approach where we start with data, that we look at interventions and impacts, we can translate that through to policies that say these are going to be actions that can help protect our health, reduce emissions, create healthier environments, and that moves towards more reasons to undertake these efforts. So where am I going to be going next with these types of issues? Well, the idea of being able to look at sustainability more holistically through this intersectional approach, but basically looking at, look, we have climate mitigation and adaptation actions that we need to bring to the built environment. We need to look across a variety of dimensions as it relates to health, an area of work that I hadn't mentioned, but working with colleagues on around energy and gender, looking at cities, looking at the energy sector, and these all need to be transformed so that we're looking at improving our processes, looking at where innovations and technologies can be adopted more readily, how our current practice evolves over time, and that ultimately we transform these systems to be completely, aligned with what we need to see in the Paris Agreement. But they have to be doing these for the reasons of health, of equity, of safer places, etc. So I think this is where, again, I want to try and build more and more into this nexus approach by working across disciplines, something that I've done for a long time, and have found those gaps that we can build more research into. And so really being able to look at building programs of work that support that. So looking at priority areas, looking at different geographies of scale. One thing I didn't mention was I've worked across many parts of the world, with colleagues there, and it's hugely insightful to look at what the challenges are there. And it's very inspiring for work that we might do in the UK. So being able to work with and develop these programs of research to transform towards that sustainable built environment that we so desperately need and that will be good for us. And on that note, thank you very much.
Thank you, Ian, for such a wonderful presentation and insights in your research. Let's get a couple of questions.
Hi, it's Mike Fell from UCL Energy Institute. Thanks very much, Ian, and congratulations. You mentioned the cost of living crisis, cost of energy crisis. Obviously, there's been big gaps and lack of policy in terms of energy demand. You mentioned the clear evidence, which has been long-standing. With hindsight, is there anything that you think the energy demand community could have done differently to affect how things have changed, proceeded on that front, or other examples of things being done now in terms of energy demand research, policy engagement influence, which could be more effective?
I think that we've done an enormous amount of making use of this real world data and really emphasizing the need for that. In fact, actually, some of the work that Taj and Simon and others have been kind of building towards, and David, around making sure that we have more access to higher resolution, more empirical based studies that support the questions that policymakers would have, which is, did that work? Or what's the potential for that that system to be used? Because the reliance on models has, put us in a position where we can't necessarily evaluate past practice very well. So the models themselves don't reflect the real world that we've been living in. And if they do, it's about an answer that we've asked and can understand. So building better models is going to be something that can only be done by building from better evidence and better data coming out of that measurement world. So I'm more of an empiricist. I like observation. I like to be able to look at what the effect is being. I don't necessarily think that we're using that to the strength of being able to project to the future as well as we could. So yeah, I'd say that relying on more data in our models is always going to be a useful thing.
Yeah.
Yes.
Just say thank you for some wonderful research and eminently sensible conclusions. But what do you do about the government, which is into economists who say that growth is the thing, and therefore they're not going down an energy saving plan. They're going to convert the energy supply to so-called sustainable.
Yeah. I mean, the question of kind of efficiency as a means in the end, and this is where I, being able to make the case around, well, that more efficient home, for example, for those who are, now we're facing a winter oncoming, you'll simply have a warmer home. This is, the fact that it was renewably sourced, and sure, for now there might be cost allowances provided, but in the long run, we really do need to focus on minimizing the demands that we would have, because at the end of the day, we have a lot of renewable energy to make use of in this country, but it seems unnecessary to use so much.
Yeah,
We don't need to.
I agree 100%,
Yeah.
but if you talk to your MP about it, they say, oh, but we can do that by using sustainable energy. There's no need to insulate homes.
Right.
And that's what the economists are pushing.
Sure, and the problem with that ultimately is we could still have a zero carbon home that is cold,
Yeah.
that is full of air pollution, that we really aren't better off for. And I think the actions that we want to see intervened into our building stock is to make them. And that's why I think this doing for other reasons, not just emissions, are incredibly important, because when we look at countries that say have a high rate of, say, already hydro or renewables, their question isn't about emission reduction. Their question is about capacity and cost reduction and other challenges that they might be facing. Thank you. Bill.
I want to follow up that point you discussed, because the work that we've been doing on the other building stocks suggests that the average range should be 20% towards solar
Yep.
There is this popular belief in mass politicians that the problem is insulation. Actually, the calculations of the what you would say about the question of speed.
Yeah.
What is it? Because changing the building stock to the is very slow and you don't see that point. Whereas maybe changing those inducing prices to can go faster.
Absolutely. So your point about, what's the limit of savings that we might have from existing buildings through efficiency alone, through insulation, through glazing replacements, through a more efficient heating system or a heat pump, perhaps. We're going to hit a natural limit to that. Our walls won't be so thick that we can bear living inside the home anymore. But you're right. I mean, the nature of the speed is one of, if the priority is to, for example, take away a reliance on direct gas use, make better use of electricity, which is, yes, decarbonized at a higher and faster rate, perhaps, then those are important to do now. But the insulation part of it is that, and the glazing replacement is the like, it still feeds towards a more, I think, comfortable home. You're not subject to the same risks around, cold weather snaps and the like, which, we is important to avoid. And, the fast entirely equipment is very easy, but it can be put into a home relatively quickly. Adding insulation onto walls is a more slow process, more costly and the like. So the efficiency improvements on one hand need to be practical and realistic. And that's why knowing which ones are giving the biggest bang for the buck, for example, and knowing, are we so affected by, for example, are we reaching a COP of 3.5 or 3 on a given system, coefficient of performance, in other words, how much is it delivering? I think that we probably need to move more quickly on that than we have been. And decarbonizing the electricity grid at the same time is going to be critical for that. Yeah.
Mark Barrett, the Energy Institute. Thanks for the talk, Ian. Great to see you again. Do you think there's a tension between, when you say efficiency and insulation, between reducing heat load and increasing cooling loads?
Yes, sure. So in a country such as England, experience of the summer and the heat waves is that a lot of these buildings are not built for heat. They are built to be warmed, and not even necessarily that well. And the problem will be one of, well, are we looking at insulating and creating an overheating risk? And it really depends, I think, on the ultimate long-term strategy where we're going towards. So a refrigerator is still an insulated box that keeps things cold inside, in the same way that it has, though, a cooling unit attached to it. So I think that as we go forward, we're going to have to do a few things, especially with the older homes in this country, paying attention to things like solar gains, making use of shades, external shades, making use of insulation that, is able to, on one hand, protect against heat gains coming in, but keeping them out in the first instance, and really using technologies such as heat pumps, for example, that can provide both heating and cooling if it's needed. And the reality is, going forward, maybe not this year and the next 10 years, but with climate change, those risks are going to continue to increase. And yes, there'll be more and more heat stressed times of the year, and cooling will be a way to protect those who have a health risk as it is. And it will create a cooling demand, which hasn't been here historically, but things like insulation will help to minimize that demand.
Or exacerbated?
If there's a heat pump, probably not. But yes, there's a risk.
Thanks, Ian. I guess I had a question about to what extent your energy epidemiology approach is kind of able to be extended internationally. It seems that UK is particularly well suited, and maybe not. You'll have some comments about how good the UK is for doing that type of approach, but you've also got this breadth of experience across international.
Yeah.
I guess what's your experience of that?
Well, so, and this again, someone who I didn't mention, who couldn't be here, Paul Roosevelt, and Taj and I worked on basically an international program of work that went through and said, well, the UK has all this wonderful data. Who else may have that, and how else can we apply these methods elsewhere? So we have an annex, which is under the International Energy Agency. Basically, it brings together people, researchers from around the world to work together on this. And one of the fundamental challenges was the data. The what I call the data foundation wasn't there. Some countries, such as South Korea, is excellent. They have every building mapped out, all the energy data, all integrated into these systems. They even do audits where they contact a company or a homeowner and say, we think you're using too much energy. Shall we have a bit of a chat about how we can reduce that? You know, heaven forbid that sort of thing might happen here. But the idea being that we do need to have a better foundation of data. You know, those very early things I was showing about the status of the stock. I mean, for large parts of the world, it's a bit of a guess. We don't know. And it's incredibly important because actually, in order to transform the global building stock, we need to know more about how buildings are responding, how we're investing in to reduce emissions, and to have a continuous process of feedback. Or else we're going to get things wrong and not know it until perhaps it's too late, or experience in lots of countries, you know, whether that be Australia with loft insulation and fire risk, whether that be this country with, you know, double glazing and, you know, poorly installed, and the need to have regulation around that. So the international practices recognize that data is a limitation, and processes are, I think, not being well established to produce that. It's still a question mark. But I would point out that the thing which Phil and Harry ultimately did was said, there's something there, there's something there, there's something there. How is it that we can bring these things together? And that, and you know, with Simon as well, instrumented a sea change of understanding of building performance in this country. And I think it can precipitate that in other places.
As we move from an efficiency to a sufficiency agenda, it seems that some of our expectations need to be questioned. And I was wondering about the one related to indoor comfort. Because I've been talking to physiologists recently, and they talk about thermoregulatory fitness, and that people have actually lost abilities being in more controlled environments. And if you expose them to more, they actually become healthier. And I was wondering whether you looked at all at that dimension in your physical fitness aspect.
It's not something that I've directly looked at, though I would certainly suggest, you know, people like Harry Kennard, who's sitting there and did a PhD using the biobank data on physical activity and temperature. But although it's not quite the same thing into the physiology side, but I think you're certainly right to the idea of me being able to know what kind of the parameter space of, you know, comfort is not so tightly defined. You know, we have ranges. We wear clothes of different sorts, and, you know, over the course of the day, course of the seasons, these are going to change. And to have it so highly regulated is probably not ideal. And I think that implies actually a better use of, you know, passive approaches that can support that. I mean, it's a good point about what Mark was saying. You know, we don't want to address one problem and create another one with our solutions. But the health concerns that I'd be mostly interested in are those that would relate to cold exposure and yes, overheating exposure risks. And for many, the temperatures I was showing at the beginning, a lot of homes might be at well below 18 degrees, well below 18 degrees in the wintertime. And it's a question of, is that in the bedroom? Because we do have monitoring that shows, and in particular among older households, that their bedroom temperatures can be very low. And the risk of that precipitating things like a stroke, the next morning when you've had a series of weeks of cold weather is one of the main factors that when we look at excess winter mortality and the sorts of conditions that relate to cold and cold exposure, we spend a lot of time indoors during a cold period, and certain individuals are more at risk. So I think that the package of kind of who to protect as well it needs to be taken into account to these types of things. So young, healthy individuals, no problem. Those who need extra support, I think we definitely want to know how effectively we can do that. Thank you.
Robin Brown from Just Space. That's a network of community groups trying to influence the planning of London at the strategic level, the mayor's London plan. Now, whenever we talk with policymakers, we always say, take the people with you. And it's particularly important with climate change and environmental matters. And given that your what's next approach to research is a more holistic approach to sustainability and confronting the societal and environmental challenges out there, how are you, or rather, how is the Institute going to take the people with you, let alone convince the policymakers?
Yeah. I think it's a great question, and one which certainly within the university, being more integrated to the community we're in, co-creation around research and the like, it's a challenge. In that I think sometimes there is a risk that what we do is just kind of sat over here, very interesting stuff, but doesn't get through to those who can help make a decision about it. And being able to, with the climate change and the countdown work and looking at those improvements to health that can be achieved today through actions that, reduce emissions, to emphasize that, policymaker can, put together an EV policy, electric vehicle policy, can put together a home retrofitting policy and say, this will protect lives and save, help people today, in the same way that it will meet our international commitments. But also emphasizing that when people say, what is it that you would recommend an individual to do about climate change? And my response is, make sure that your elected officials know that you care about it, because they're going to be the ones who can make a change on your behalf. And I think by bringing these types of messages to the community to say, look, here's why this is important, can help raise that voice. So I'm hopeful the bringing with is by virtue of informing. Nope, go for it.
My roots are really in Africa, and for the last few years I've been employing supply chains of fossil fuels, the renewables, which are 100% reliable comparing fossil fuels to lithium and the cobalt in these products, which people think for some unknown reason that renewables and fossil fuels were rubbish. My question is, when I see today green activist groups are borrowing to the fact that fracking started in the UK, but they're not borrowing to when my lands, indigenous lands in India, are mined up and excavated and enriched for extracting the lithium and the cobalt for the electric cars.
Yep.
This is sort of a new sort of green colonialism where we don't want the fracking in our backyard and carry on in the global south. And it's disgusting. The amount of racism I've seen within, not from the average white Joe on the streets, but within climate change communities, where they are borrowing. On one side, they're saying we need to listen to the indigenous, listen to the global south. When they're faced with the realities of what's happening in the global south and how that's eventually going to come into the east and the global north, all of a sudden they keep screwing. They don't want to listen to that. Now, the question is with oil prices rising, with Pakistan back on the floods in the US, one thing a lot of people do not seem to be waking up to is when those countries are on the water, and those people are starving themselves, hundreds of millions, billions of people, how are these obligations of meeting renewables in the UK and the West going to be fulfilled when it's reliant on enslavement on those people? It's not going to be good. Those people in the global south saying, I'm going to eat first. Now you're going to get your products in the UK. When we're on the water and oil prices are so high, we're not even going to get them shipped out.
Yeah.
So that's something that no one seems to be willing to address.
It's an incredibly important issue, and I cannot, I absolutely agree. It's not an area which I know very much about with respect to what you've raised. But I think it's one where, yes, when we look at all these great plans, they have to, of course, consider equity as a part of them. They have to consider how is it that we're going to ensure that those communities from where resources are coming from are benefiting. The work, some work I did with colleagues in Mexico was very much around, well, all of this renewable energy from wind farms being placed on the lands of indigenous peoples, which are then being told you can't access those lands for your historic rights, with complete anathema. And it effectively stopped wind power. I mean, a change in government also stopped wind power production, wind power development. So without that sensitivity to cultural and locational challenges, then of course it's going to fail. So I think that it's probably a valid point, which absolutely needs to be considered.
Just very quickly on the mention, why is it that we see the reforestation, extraction of raw materials for renewables as a solution to climate change? And then when the floods happen,
Yeah.
we don't realize that floods are symptomatic more than that for extraction.
Well, it effectively leads to something which we know around unintended consequences and unanticipated consequences, which are effectively that without a more, holistic understanding of these challenges, you're going to be inevitably going to be making mistakes. Being able to bring that evidence back into view, as you point out, is incredibly important for those of us who, advocate for this solution to the future. It needs to be done carefully, entirely.
I'm afraid we have
We-
to close.
We do.
Absolutely. Thank you so much again,